Good afternoon, everyone. Over these past few weeks, the entire city of Chicago has been able to enjoy the welcome reopening of many of our businesses and public spaces since we entered Phase 3 of our reopening framework. That includes today's partial reopening of our lakefront and the 606 Trail. It's because of the shared commitment and sacrifice of all Chicago residents and businesses that we're able now to safely take the next step. I'm very pleased to announce that Chicago will be transitioning into Phase 4 of our reopening plan starting this Friday, June 26, with new guidelines. First, while we will be maintaining a limit on indoor capacity at 25%, we are expanding the size of permitted gatherings. Indoor gatherings may now go from 10 to 50 individuals, and outdoor gatherings may increase from 50 to 100 individuals. Second, we'll be opening the following industries and subsectors with restrictions earliest in Phase 4. For the first time since they were forced to close back in March. I'm happy to announce that that includes our museums and zoos, performance venues and movie theaters, summer camps and youth activities, indoor use of restaurants and bars, as announced last week. Unfortunately, because of where we are in the arc of the virus, industries that require very large gatherings, such as spectator sports and conventions, will at this time remain closed in the city of Chicago. All the new steps and detailed guidelines related to Phase 4 are available online right now at chicago.gov/reopening. And I encourage everyone to visit this site because it is the best place to learn about the latest information for both employees and employers, as well as for every Chicagoan wanting to know what to expect when they leave their home. This is important because we'll continue to make updates on our guidelines throughout Phase 4, depending on the data of this disease. It's also important because the guidelines for Phase 4 in Chicago are different from the rest of Illinois, and they're different for a reason. We have been working closely with the state throughout this entire process. The challenges Chicago faces in safely navigating this crisis are unique and different from the rest of the state, for reasons you'd expect. We're denser, more residents take public transit, and we're an international air hub. That is why anyone who is in Chicago must remember to follow the Chicago-specific guidelines. I want to reiterate something I said when we entered Phase 3. Under no circumstances should our move to Phase 4 be confused with this crisis being over. COVID-19 is still very much part of our present in Chicago, and it will be for the foreseeable future. And we want to also emphasize that having a resurgence in cases is more than a risk. It is a very real possibility if we, meaning you, don't do everything possible to follow the guidance and minimize the risk of a resurgence. That means social distancing. That means wearing a face covering when you go outside. That means following all the hand hygiene rules that we have emphasized since March when this virus really hit the city of Chicago with full force. Now, as you can see from this slide that's up right now, every single zip code in Chicago saw new cases of COVID-19 just last week. Every single zip code. And while we're trending down, this map shows how other places are trending up. And we need to make sure we keep moving in the right direction down and not unfortunately suffer the fate of many states in the South and the Southwest that are trending up with new cases, new records in cases and deaths being announced every day. That is not what we want to be the story of Chicago. But again, that depends on all of you following the guidance. We've been following these surges in other cases with great concern. And if it happens here, We will not hesitate to take the necessary steps to keep COVID-19 from rapidly spreading here again. And such steps include moving us back to phase 3. Now, this is why I want to emphasize the importance of continuing to wear face coverings, physically distancing when meeting others, as well as continuing to wash your hands regularly. Meanwhile, anyone who is sick still must stay at home. Don't try to be a hero. If you're ill, you must stay home, as well as anyone who's come into contact with somebody who has COVID-19. And those who have COVID-19-like symptoms must immediately reach out to a healthcare provider. Our job now is to be safe. In order to be safe, we have to follow the guidance. And Chicago's businesses have been doing a good job in ensuring we do so. I want to commend those of you that have not only been adhering to our public health guidelines, but finding creative ways to continue operating while still remaining safe. It's this service and sacrifice made by you and countless other Chicagoans from every corner of our city and every walk of life that has allowed us to safely reach the point where we are now. It includes the incredible work done by our healthcare professionals, first responders, essential workers who have cared for our residents in a time of great need. They have kept our city running. And again, we can't say enough to thank them, along with the work of thousands of others who have stepped up for their communities during this time of need. And that's in addition to all the Chicagoans who did their part by staying home and saving lives. Everything that we've done to this moment has been a direct result of your hard work and sacrifice, which has not only saved thousands of lives of Chicagoans over these past 3 months, it really helped lay the groundwork for the transformative recovery that will follow. So I want to make sure again that we emphasize we are taking this step because of the hard work and sacrifice of so many. The only way we continue to move through phase 4 and into another place is if we continue to be smart and selfless in making sure that we follow the various guidelines. And now I'll invite Dr. Arwady to provide further details on our where we are in our city's health metrics and why we are taking these cautious steps forward and not just throwing open the barn door and letting anything go. Dr. Arwady?
Thank you, Mayor Lightfoot. So I want to echo the mayor's excitement as we're looking ahead toward phase 4, but also emphasize that now is the time to remain cautious and remain conservative. We've seen excellent progress through phase 3. And in fact, we've hit our metrics even sooner than we thought that we would. And that is during the time that we have cautiously reopened. The idea is that if our city on a whole is on a downward trajectory from COVID-19, we have the space to be able to handle the increased opportunities for spread that the virus has as we reopen. If we look at all of our metrics, these are the same metrics we've been following since the beginning. They're the same metrics we'll continue to follow. Overall, at this point, we've been following new cases every day. We've been following new hospitalizations, new deaths, and new emergency visits. All of these have continued in a downward trajectory since early May. We've been following our percent positivity. That's the percent of the tests that are positive among all that are done. We had set 7% as our goal to move ahead into phase 4. We're actually just below 5% at 4.9% this morning. We want to continue to see progress there, but it's really been a major, major step forward. Hospital capacity remains very good. We've got fewer than half of the number of beds taken up by COVID patients that we're able to handle as a system, and that continues to downtrend. Our testing capacity is back to where we needed it to be. We want to be testing at a minimum 4,500 tests per day just in Chicago. That means that we're testing 5% of Chicago residents every month. We will continue to be growing that, continuing to be pushing testing where it needs to be. But I want to emphasize that this progress that we have seen across cases, deaths, hospitalizations, percent positivity has been across the city. As the mayor pointed out, yes, we are still seeing cases in every zip code. And yes, we are still disproportionately seeing cases, especially in our Latinx and African American communities. But the progress there has also been excellent. The zip code that has the highest percent positivity at this point is down to 15% and falling. And we will continue to push to make sure that there are not zip codes or race ethnicity groups that are being left behind as we make progress overall as a city. Finally, our response capacity. This points to the ability of the public health department and our many partners to handle new cases, to do the investigations, to do the contact tracing, to do the testing that needs to happen to make sure that we can stay in control. We had set a goal here to make sure that within 24 hours, 90% of new COVID-19 cases would be assigned to investigators, and we have met that metric. I encourage you to visit the dashboard. We have so much data available, and all of the data that we see at the health department, you can see and follow right along with us. We have weekly totals and trends up there, and I'll point to the fact that we've been seeing not just small decreases, but big decreases continuing over phase 3, where we look just last week, we had a total of over 1,200 cases, but that was almost a 25% drop from the prior week, consistent with what we've seen in weeks prior. We had testing actually go up by about 27% in that prior week, and some of that again was with the decline that we'd seen, but we've come back up and not seen any change in the continued improvements either in cases or percent positivity. Deaths, similarly, we had about a 27% drop from the week before there, and then our percent positivity in 1 week had gotten down to 5.2%. Today it's 4.9%, but that was down from 8.6% just the week before. It's been really good, consistent progress. I encourage you, especially when you go to the dashboard, which I'll remind you is at chi.gov/COVID-, or you can also, as always, get there from our coronavirus website. And I encourage you to watch our daily data with us. This is where, when you pull that up, you will see that first green number. Hopefully it stays green. That means we're continuing to see progress. That's our confirmed cases, and that's a 7-day average. As of today, pulled off the dashboard this morning, we're at 167 new cases per day on average. You can see just from the prior day, we were down by 3%. We track this week over week, but of course, every day we're looking at it. Similarly, today was the first day that we had a percent positivity below 5%. We had been at 5.1% yesterday, 4.9% today. I encourage you to watch along with us, especially those new confirmed cases, because these are what help us know what the ongoing risk is in Chicago. So this is our overall graph. I encourage you, again, I'm not going to pull them all up to show what they look like, but broadly, they all look like this. Very good decline since early May. This is the new case counts, the one we're most interested in. But I want to highlight on the right there, you'll see that there's a high incidence and a moderate high incidence mark. And that's because just now, Chicago finally is moving out of a high incidence, meaning a high risk state for COVID. Based on our population, these are the national numbers that CDC follows if you look at national maps. While we've been over 200 cases a day, which is where we've been since March, we've been in a high incidence state. And just now, we're moving into that moderate high state. Really good progress, and one of the main reasons that we feel confident that we'll be ready to move ahead to stage 4 with the rest of the state at the end of the week. I also want to point out what this point about high incidence and moderate incidence has to do with the actual risk that here in Chicago, someone at a gathering of a given size will have an active COVID-19 infection. So where we are now, adding around 200 cases a day, we know that people are infectious for about 10 days generally from the time that they first acquire COVID, which means that at any given point we have around 2,000 active infections that we know about here in Chicago. However, as you've heard me say before, there are many, many cases of COVID-19 in Chicago that are not diagnosed. We know that because of our case fatality rate. If you look, about 5% of people in Chicago who have been diagnosed with COVID have died. We've had about 2,500 deaths, about 50,000 cases. But the actual mortality rate for COVID is probably more like 1% or even less. And that lets us know that there are many, many more people who have mild symptoms or even no symptoms of COVID. This is why it is so important that people are wearing those face coverings and keeping that 6-foot distance. It is a given and it is the law that if you are feeling ill, you must stay home. So it's really these people who may not have symptoms but could be out and in a gathering that need to take the precautions. And so if you look, based on where we are now, with the assumption there are likely still around 10,000 active infections in Chicago. A gathering size of 10, based on our population, means that there's a 5% chance that someone at a gathering of 10, in a random gathering, will have an active COVID infection. At a gathering size of 50, that goes up to about a 15% chance. At a gathering size of 100, we're getting up to a 1 in 3 chance that someone has active COVID. And at a gathering size of 250, we're coming on almost a 2/3 chance that someone at a gathering has COVID. And so this is why, if we look, we're setting right now, as we move ahead cautiously into phase 4, we're setting that group, that gathering limit at 50, because that's the 15% chance that someone in that group has COVID-19 and may not know it. Later, as we are able to move ahead, we'll be able to expand on this. So I encourage you to take a look at this on the website. We'll post it. But this again gets to the point that previously we've been high incidence. Just now we're moving into that moderate high incidence where we're at between 100 and 199 new cases per day. Our indoor capacity limits are going to be at 25%, with indoor gathering limits of 50 people and outdoor gatherings of 100 people. But you'll see that we are already thinking ahead to what comes next. If and when we continue to see progress within stage 4, when we get down to a moderate incidence state, where we're seeing between 50 and 99 cases per day, at that point, we'll be able to move to a 50% indoor capacity and an indoor gathering size of limit of 100 people, because the risk of there being someone with COVID in a gathering of that size gets cut in half, and so on and so forth. So moving to phase 4 does not mark the end of COVID-19. It marks the beginning of another step forward and another opportunity for you in Chicago to double down on the things that we know keep us safe and the things that will allow us to reopen further. To have more people in the indoor restaurants and in the museums and in the zoos, and to be looking ahead towards when we can hopefully be back in school in some capacity in the fall. Us continuing to do the things that we know work are what will allow us to continue to make steps forward in phase 4. So please keep visiting the website. That's the data we look at every day, and it's the data that we'll be sharing with you. We have plans for going forward, we have metrics if we need to pause, and we have metrics if we need to take a step backwards. But our goal is to move cautiously ahead, to not have to take those steps backwards. Keep doing what you know works, and we'll keep you updated as we move ahead into phase 4. And with that, I'll invite Samir Mayakar, the Deputy Mayor for Economic and Neighborhood Development.
Thank you, Dr. Arwady, for that introduction, and thank you, Mayor Lightfoot, for your steady leadership during these challenging times. Good afternoon, everyone. I'm pleased to be joining you today. And I'd like to begin by echoing Mayor Lightfoot's comments and commending the discipline, the patience, and the hard-fought efforts of Chicago's residents and business community over the past several months. All of you have been true partners on this challenging journey of reopening, and my team and I are incredibly proud to be working with you towards developing solutions to keeping your businesses and our city running despite the COVID-19 pandemic. As the mayor noted earlier, I've been especially energized by the spirit of collaboration and ingenuity that's been on full display across our city. And I'd like to take a few moments now to highlight some of the stories of resilience that we've seen from Chicago's businesses and customers during this unprecedented crisis. In our tech economy, we have the local startup HealthJoy, which offers an employee benefits experience platform to help employees navigate their health benefits. The HealthJoy team worked nonstop at the onset of the pandemic to make it easier for employers to provide benefits in terms of telemedicine to their employees. The product that they build will make it possible for companies to offer telemedicine and concierge health support to employees in just 2 business days, rather than the typical onboarding process of many, many months. And earlier this year, HealthJoy was also able to raise a venture capital financing round of $30 million to continue growing their team and creating jobs in Chicago. Now, over at Navy Pier, the outdoor restaurants and shops, which had been closed throughout the pandemic, had over 50,000 visitors during their first 10 days of being open. And as you can see, they really maintained the key principles of social distancing and capacity constraints among both employees and customers. The city was also proud to partner with local chambers of commerce on our pilot Open Streets initiative, which allowed restaurants and more recently bars to maximize their outdoor capacity. And I'm proud to say it's been a tremendous success. You can see here all the tables being distanced from each other on Rush Street. And this program is now operational in several commercial corridors throughout the city. In fact, we expect many more neighborhoods opening outdoor dining options this coming weekend, including Chinatown, Taylor Street, Chatham, and Andersonville, as well as more than 30 private parking lots that are now outdoor dining spaces. So we've worked with businesses to understand what best works for each area, and our team has responded quickly with tailored solutions that address the restaurants' and bars' needs. Commercial boating began in Phase 3, and the lake and riverfront tours, a hallmark of Chicago's summer, one of my favorite things to do in the summer, they also found their way to operate at limited capacity with adequate social distancing. And as a reminder to everyone, and I know Superintendent Kelly, who's here, will remind you as well, our harbors are officially open today. And the list goes on. Last week, when outdoor capacity for bars and brewing opened, I stopped by Metropolitan Brewing up in the Avondale neighborhood on the North Branch of the Chicago River to visit fellow entrepreneurs Tracy and Doug. Now, for those of you who don't know, Metropolitan is actually the oldest independent brewery in Chicago. And when it came time to open, they were ready with everything from sanitizing protocols to information cards for their customers, which you can see here. And what you're looking at now in this next picture is a server at Red Barrel Restaurant, which is a community staple in the Archer Heights neighborhood near Midway Airport on the southwest side. And as you can see, restaurants are one of the most regulated industries from a public health perspective because they need to be, and we've been extremely encouraged by seeing strict adherence to public health protocols. And last but not least, on the south side, in one of my favorite neighborhoods, Auburn Gresham, here you have a picture of Elijah Brewer of Brewer's Coffee and Custard. Now, this property that Elijah opened up has been in his family for a number of years. He's also actually the chairman of the finance department at DePaul. Now, Elijah experimented with his mother's custard recipe to get his store up and running on the 79th Street corridor, which is a key focus area for Mayor Lightfoot's Invest Southwest initiative. Last Friday, the store provided free custard and coffee to visitors in celebration of Juneteenth. And in partnership with our move to Phase 4, we'll be expanding hours this coming weekend. So I encourage you to go down there, check out Elijah's store, and while you're at it, go visit Auburn Park, which is one of the most beautiful parks in Chicago. So this is what we mean when we talk about the spirit of resilience and innovation of our city's businesses. So Chicago, let's keep the momentum going as we move to phase 4 on Friday. We expect over 200,000 Chicagoans to get back to work in phase 4. Let's show the country how to gradually reopen, get the economy moving, and do so in a way that moves the needle in the right direction when it comes to our health metrics. And if your business needs more support, we invite you to apply for the newly launched Together Now Fund, designed to help businesses recover from the impacts of COVID-19 and other recent events. So please visit chicago.gov/togethernow to get started. This application will be open for the next 10 days. Thank you very much, and I'll now turn it back to Mayor Lightfoot for questions.
Jack, can we pull up slide 12, please? So before I take your questions, I want to emphasize this slide that Dr. Arwady talked about. There are some who think we should just do nothing, have no restrictions, no capacity limits. But here's why. When you think about a gathering size of 100 and having a 30% chance of somebody in that 100 having a COVID virus, when you go up to 250 and that probability goes up to 60%, this is why we are being cautious and prudent. We do not want to go the way that we've seen other states, other cities. We want to make sure that we turn the dimmer switch ever so slightly, consistent with the public health data. Chicago is unique. We can't speak for what happens in the rest of the state. But what we do know is we have lots of active infections here still. And it's incredibly important that we don't ignore that fact. And I know that the way in which we're taking this approach, turning the dimmer switch cautiously, continues to cause economic harm and hardship. We recognize that. But my first responsibility as mayor is to save lives. And we have done that, and you have done that, and we will continue to make that the priority. And with that, I'm happy to take your questions.
Mayor, I'm Vince Gerasoli from Channel 2. There are a lot of questions today, so I'll try to consolidate them as best as possible. You talked earlier about some situations in Chicago being different from the state. Can you think of just one and help us understand the thought process that went into that decision?
Well, I just showed this chart on slide 12. You want to go back to it, Jack? There are places in the state of Illinois who had very few cases, and in some instances, next to none. That's not been the experience, unfortunately, in Chicago. We're a large urban center, we're denser, we're more compact, we have more instances where people congregate. So decompressing that has been a critical part of our strategy, but it's got to continue to be a part of our strategy. So that is a significant difference between us and some less populated areas of the state. We've got to do what is in the best interest of Chicago based upon the data that is here. A blending of information across the state doesn't help us. We've got to go with the Chicago specific data, and that's what we've done from the very beginning.
Some of the capacity limits are per space, not per venue. So can you help us better understand how that impacts, for example, a 3-story restaurant or a museum that has 8 large spaces where people can attend?
Well, a lot of it is also going to depend upon making sure that people in a museum, for example, that they move. I mean, part of the reason that the Park District has adopted the Keep It Moving strategy is because we know that if you're mobile, even in an outdoor space, you minimize the risk. This is all about assessing risk. Risk is absolutely higher in indoor spaces, in part because air gets recirculated. So thinking about these different venues and then thinking about what the measure of risk is an important part of the calculation. Dr. Arwady probably would like to expand on it, but it is about measuring the risk. It's not one size fits all. It's not apples to apples in many instances, but we've been very thoughtful in coordination with our various industry partners in thinking about what are the proper guidelines at this moment based upon where we are in the trajectory of the virus. Dr. Arwady, I don't know if you want to add to that.
I would just add that the 25% capacity is pretty much across industries. That 50-person limit is related to a room, a floor, a space. So say you had a 3-floor restaurant or a 8-large-room museum, you could have 50 people in each of those spaces that is sort of an enclosed space. So hopefully that helps clarify.
Dr. Arwady, while you're here, the original date to move to phase 4 was July 1st, and you've gone over some very impressive metrics, but can you help us better understand the moment when you saw that perhaps you could recommend moving sooner?
Yeah, so when we announced July 1st, we said that would be the likely time, looking at where we were expecting to be, but we said even then it could possibly be sooner if we exceeded our metrics. I think it's already the potential for some confusion among people living here in Chicago if they're hearing about different dates that the state is moving versus dates that the city is moving. And so first, I think there's a practical consideration that if we felt like we were there, we wanted to be able to move at the same time. But more importantly, the data really let us know that we were there. When we moved into phase 3, you might recall one of the reasons we waited, we didn't move with the state, was that we had not hit that 15% positivity mark that we had set. We had set 7% positivity as our goal, for example, to move to this next phase, and we've blown right past that. We're at 4.9% already and continuing on the decline. And then the other thing I would say is that it is really important for us, where we think about risk, to have moved from that high risk, that high incident state, into the moderate high. We're heading towards moderate, of course, eventually we're heading towards low, but we've been at high for months, and we had set, in addition to the metrics, that if we'd been able to move to moderate high, which we have, again, 167 cases is well below the 200, we would feel confident moving ahead with the state this Friday, and that's what we're doing.
Thank you, Doctor. Mayor, this is for you, and it comes from John Byrne at the Chicago Tribune. What does moving to phase 4 mean for fans attending professional sports? If Major League Baseball, the National Hockey League, and Major League Soccer hold games in Chicago during phase 4, would fans be allowed to attend at 25% capacity at the stadiums with 6 feet between people in the seats?
As a big sports fan, I love the question. Look, we are in constant conversation with all the professional sports teams, and a lot of that is going to be dictated by what their league offices, in conjunction with the players' associations, really say. My expectation in the short term is that they will reopen, but without fans in the stands. My hope is that over time we will get to a place where we can start to see some fans in the seats at stadiums and other venues. But look, they're being smart, they're being prudent, just as we are. Their most valuable asset, of course, is their players, and we want to make sure that when they reopen, they're doing it in a way that the players also have confidence that their health is being protected. And right now, I think that means, in the short term, reopening, but without fans actually physically present.
I'm going to consolidate about 3 questions
Okay.
here, but a number of my colleagues have questions about the opening of beaches, playgrounds, and pools.
Mm-hmm.
When might we see those?
I think we're still a ways away from those. And again, I'll let Dr. Arwady talk about it. But what we're concerned about, and I want to emphasize something about playgrounds. You know, I've been driving around the city, as I always do, and I see a lot of children playing on playgrounds. The playgrounds are still closed, and they're going to be closed for the foreseeable future. We're not cleaning those playgrounds. Parents, you need to be careful and cautious. My recommendation as a parent is don't go on the playground equipment because it's not being cleaned, because they are officially closed. So again, the concern there is, given the congregation, given the frequency that would be needed to try to even realistically keep up with the cleaning, just doesn't make sense right now. And I can let Dr. Arwady speak more to pools and beaches. We have very robust discussions about each of those. We meet on a regular basis to talk about where we are, what the future looks like, and we've been talking about beaches and swimming pools and splash pools for some time. But based upon the healthcare guidance, we're just not there yet. Dr. Arwady?
So that's right. We know that it's summer. We know that there is a lot of interest in being able to see some movement here. And as our outbreak allows us to, we'll be moving ahead. Let me hit them sort of one by one. So playgrounds, first of all, are impossible from a social distancing standpoint. They really are. You think about young children and the ability to sort of keep 6-foot distance on a playground, it really is non-existent if we're going to be honest. And we know that kids love playgrounds, but we also are concerned where we still have, again, a relative, we're just getting into a moderately high incidence of COVID here in the city, that we're not at a point yet here where we can really have that uninterrupted interaction. And so, as the mayor said, we're not cleaning them, they're closed. And we would ask parents to please not unnecessarily put kids at risk at this point. Where we think about pools and beaches, so let me just be clear that the water itself is not a concern for COVID spread. The risk is that individuals who breathe on each other when they are at beaches and when they are at pools have the opportunity to spread virus. And of course, in water, it is basically impossible to wear a face covering. And we've been having a lot of conversations and really watching closely what folks around the country are doing related to this. At this point, basically, we've talked about unless we get into a heat emergency type situation, we don't have a plan to have pools open. And beaches are also not open yet, but we'll be watching carefully. And again, this is going gradually, seeing how steps are being taken. Only today is the lakefront open officially for the first time. We want to see how that goes with a keep it moving. I think we'll be looking ahead through the 4th of July, and then at that point, really be doing some assessment. When people do go to the beach, it will be very important that social distancing can happen, which means not having, crowds there as well. So our hope is that it will be coming, and the way we get there is to see our cases keep coming down, and the way we get there is to have people doing all the things that we know work.
Dr. Arwady, while you're at the microphone, Jim Daly from the Southside Weekly has a question. As the city moves into phase 4 with mental health clinics, will mental health clinics continue to provide services primarily via telephone? Is there any timeline for reopening in-person services?
Oh, sure. So our mental health clinics, as it sounds like the questioner knows, have continued to serve patients throughout this whole outbreak. We moved to a telephone-based model primarily, and then actually have acquired the ability to do some of the in-person or the teleconferencing, which is even better from that standpoint. We've actually seen our no-show rate drop in that context. But we have actually continued to see patients in person where there was an acute need for that. So if there's a patient who does not have a telephone, if there's a patient who gets an injectable medication to help treat psychiatric problems, for example, in a limited way, we have continued to see people in person. The department, the city is doing assessments of all of its buildings, and as our buildings, including our mental health clinics, are assessed, and any changes are put in place that need to be there to help protect both the patrons and our staff, we will then be moving back to a more of an in-person role. But frankly, we've found the ability to have a lot of virtual mental health services in particular. Our patients have really liked it. Our staff have liked it. Productivity has gone up. So I expect that we will continue a significant portion of these teleservices, even as we continue to bring back additional in-person as it's needed.
Mayor, this next question is for you, and it's from Amy Jacobson at WIND. She asks, as we move to phase 4, what does that mean for CPS high school sports? Can they have summer practices?
Well, a lot of that, again, is going to be dictated by IHSA, and we will continue to work with them and the Illinois State Board of Education. You'll see in further steps, in phase 4, we anticipate that sports will happen over the course of the summer. And of course, when that starts, if it starts with high school sports, will be part of a conversation that we have with all these other stakeholders. And I should emphasize this, phase 4 is we don't anticipate it being static. So we're emphasizing that we're starting, but we're going to have progressions through phase 4 depending on what the healthcare metrics are. So we expect to see some movement and other things coming online, even in phase 4.
Mayor, a number of my colleagues have some policing questions
Sure.
for you, so I'm going to switch topics just a bit. Police, this is from Fran Spielman over at the Chicago Sun-Times. Police Superintendent David Brown told his top deputies shortly after arriving in Chicago that he wanted to hold the number of homicides this year under 300. With 104 shootings and 14 homicides over Father's Day weekend, we're already approaching 300, and June isn't even over. What happened, and how do you plan to get a handle on this? You called his plan for Memorial Day weekend a fail. What do you call Father's Day weekend?
Look, I think what the superintendent said when he had this ambitious idea of 300, he called it a moonshot. And the idea was not so much the number, but making sure that we rallied all the resources, both within the police department, but also with our various partners, to really focus on what each of us could do more around public safety. I will tell you that that's been challenging over the course of the last month, and I've said this before. We still have some concern on the part of the county about how many people can safely be in Cook County Jail. We still have some concerns about bond decisions. Our federal partners are still not back in full complement. I don't believe grand juries have been reconvened, and many federal agents are still not back doing the work that they normally do. Public safety in Chicago, like most big cities, is a big ecosystem. There's lots of different inputs and partners. And the challenge that we have faced is, while Chicago Police Department has been out there, many other parts of the system have not been up to full complement. That's why we have to continue with our collaborations with the state's attorney, who's a great champion for the Chicago Police Department, and making sure that violent individuals are held accountable, meaning locked up. We have to continue our dialogue with the courts, particularly the criminal courts led by Leroy Martin, and I will be convening a meeting of those various stakeholders later this week to talk about things each of us can do to step up to stem the violence that we saw this weekend.
Mayor, this next question comes from my colleague Dana Kozlov at CBS 2. She wants to know if you can address possible blue flu Fraternal Order of Police text that went out to officers over the weekend, encouraging them to call in sick. And also, do you still have confidence in Superintendent Brown, or are there possibly some moves now to possibly replace him?
No. I mean, I can't even believe that someone would even ask the question. Superintendent Brown has been here for 8 weeks. He's a tremendous leader. He has walked into a very difficult circumstance that other police superintendents and chiefs are facing across the country. Policing in the time of COVID is not easy. And no one should underestimate the level of challenges that are there. I think David Brown is a great leader. I think he's dug in. He really understands the department well. And I think he's going to end up being one of the best superintendents in the history of the department. I've already forgotten the first part of the question.
It was a text that apparently went out to the Fraternal Order of Police.
So when something stupid like that happens, to basically tell officers to abandon their post, that is the height of dereliction of duty. And if FOP does something like that, that makes them increasingly less relevant to anything related to policing in Chicago. We certainly haven't seen that, so I appreciate that the members ignored the stupid advice that they apparently got. But what we've seen is our officers are out there, they're working hard, they're tired. There's no question about it. You know, when we were dealing with the violent protests, the looting, people were working 12-hour days. Days off were canceled. That's not a long-term sustainable play, and they're tired. And they're also discouraged when they make an effort to take hundreds of guns off the street, as they have in the last couple of weeks, and they arrest people who are really, really violent, only to see them back on the street again quickly. That's why we need to continue to lean into our partnerships and collaborations with other parts of the law enforcement ecosystem in the city. The Chicago Police Department cannot do this alone. No one has any illusions that they can. We need all of our partners.
This next question comes from WBEZ and reporter Chip Mitchell. A public health crisis in Chicago that's now intensifying is gun violence. What new investments, apart from policing, is the city making to take on the crisis?
Well, if you paid attention to the ordinance that was passed last week by the City Council, for example, we are making significant investments in a number of areas that we already said we valued because we put them into our 2020 budget. We're making more investments in mental health, in healthcare, in violence reduction that goes to community-based organizations, in affordable housing, in homelessness, more money for small businesses to help them stand up. So all the things that we know are important to create strong, healthy, vibrant communities, we have doubled and tripled down in our investments, and we will continue to do so.
Switching back. Okay, switching back to reopening, this is from
Sure.
WTTW, and Patty Wetley, she asks, can you please clarify or confirm that smaller music venues and other performance spaces that do not have seating will not be able to reopen even with capacity limits in place?
That's like 10 double negatives, so let me make sure.
I think what she's saying is that a number of venues don't have seats, and so they're not reopening. If a venue doesn't have a seat, like a Hideout or Martyrs, one of those places, will they be able to reopen?
I don't think that's correct. Does Samir, do you want to address that? And we've been in constant conversation with many of them. Go ahead.
So on the performance venues piece, so the guidance from public health has been, having an audience that's seated at a safe social distance, maintaining 25% capacity, and then 50 people max in any given indoor space. So for those small independent venues where there's only standing capacity, we are still continuing our dialogue for them. They will not open early in phase 4, but that dialogue will continue. And that's one of the reasons why, under the mayor's leadership, we've helped support the Illinois Arts Fund for Relief to make sure that those venues that they've always been worried that they were the first to close and they'll be the last to reopen, that we provide as much support as possible. And the goal really is to safely get them open as soon as we can.
Last question.
This is from Kelly Bauer at Block Club. Why isn't Chicago requiring businesses to require masks, and why aren't we requiring masks if you travel on the CTA?
Well, I think that most businesses are requiring people to have masks before they can come in. If you go to a lot of stores, there's a sign on the front door that says essentially no mask, no admittance. We are encouraging people to wear masks anytime, I'll say face coverings, anytime that they're out in the public. And we're going to continue to push that messaging home. We know it makes a huge difference. We know that it will reduce the spread and the risk. So we're encouraging everybody, anytime you leave your house, wear a face covering.
You're encouraging, but do you have the power to tell people they need to be wearing masks?
Well, the reality is it's much better to educate people into compliance. We're not going to write people tickets if they don't wear masks. I know that has happened in other countries. I don't think that works in the United States. We do want people to wear face coverings every single time you leave your house. It is the safe, smart thing to do. I think increasingly what we see is more people understanding that and adhering to that guidance, and we're going to keep doing everything we can from a messaging and communication standpoint to really preach the gospel of why, just like you should have a face covering on. So thank you very much. Appreciate it.
Mayor, thank you, everyone.
Thank you.